Yeah, good afternoon, everyone. Yeah, welcome to our live broadcast. The first live broadcast ever. And I want to say welcome to everyone. First and foremost, I want to say Happy New Year to everyone. Brought to you by my stops. If you have joined this live yet, please kindly signify. You know, the last time we informed you that the first person that joined, the first set of people that joined, they have a giveaway. So if you have joined, kindly drop your name and where you are reaching out from, where you are listening to us from, or you are watching from. Yeah. Okay, Sandy Mbalu. Hey, you are welcome. Welcome. Please, we would like to know where you are watching from. What's it called? Sandy Mbalu. Please, if you are just joining our live broadcast, we would like to know your name and where you are joining from, so as to be able to select our first set of giveaway winners. Thank you so much for joining. This is Mary's Top Live broadcast, brought to you live and direct. Samuel B. Oh, Samuel, you are welcome. You are welcome. Please kindly drop where you are watching us from. So we have our second winner here. You are welcome. Good afternoon once again, everyone. If you are watching us just now, this is the Instagram, the live session, live broadcast brought to you by Mary Stops. And this will be the first ever live broadcast. So we have our giveaway winners, and if you are just joining, you can still join. Kindly indicate where you are watching from. Kindly indicate where you are watching from. So we have the first set of people, 5 set of people to get a giveaway. Oxmer, so good. So we have Sandy, we have Samuel, we have Kande Kamara, we are Oxmers. Oh, great. Thank you so much for joining. Yes, please do well to also reach out by sharing this live broadcast to other people so that they can join as much as possible. You are welcome to our first live broadcast for 2025. I want to say welcome. I believe you people, you've been learning a whole lot over this while, and want to use the opportunity to say thank you so much for your engagement. At least our priority is to ensure that Maristo, both men and women can make informed choices, and they are empowered to take charge of their health. You are welcome, Williams. Ezekiel would like to know where you are watching from. Rugiatu Kamara, hi. It's just remaining like a bit for you to actually meet up with the first set, but it's not bad. Please do well to share this live broadcast to other people, your friends, your contact list, everybody, because we are here to learn and to be able to learn from one another. Because this 2025, we will not jeopardize having to live right, living healthy for anything. So we all have to learn together. Aisha Janel, you are welcome. Museta, thank you so much for joining us here. Sarah Solomon, you are welcome. J. Fode Musa, thank you so much. Thank you so much for joining us. Okay, please, if you have joined this live broadcast, kindly write where you are watching from. We want to know our reach. The goal is to ensure that Sierra Leone is healthy altogether. And you know, when Sierra Leone is healthy, every one of us is healthy. So you have to also share this live broadcast to every of your friends, your enemies, even your family member. So this is just 9:04. At exactly 9:08, we'll be going live to start our questions. If you have your questions right now, please do well to drop them in the comment section as we start. Sandy, thank you so much for joining. You are welcome. I want to say Happy New Year to you, Felix Marco. Thank you so much for joining. Please indicate where you are watching us from, where you are joining from. Williams Ezekiel, Happy New Year. Freetown Sigelion, you are welcome. Maria Majiro, you are welcome from Waterloo. You see, people are representing. Bo Makini, I'm not seeing all of you guys. Where are you people? Where are you people? Where are you people? Please indicate. Kabbalah, I'm expecting to see a lot of you from Kabbalah. I've not seen anyone there. And every other part of Sierra Leone. We want to be sure that we are able to reach a wide reach of the population here in Sierra Leone. Mariama, you are welcome. Sarah Kamara, please, as you are joining, indicate where you are watching from. And do well to also share. You should not be stingy. This year, don't be stingy. This year's slogan is "Day for who, day for you." So, day for your friend. Send this link to them so that they can also learn from us and also teach us if possible. And as you are joining, if you have any burning questions, please go ahead to drop them in the comment section. Victoria Jawad, thank you so much for joining. Please, where are you joining us from? We'd like to know. Mohammed Conte, where are you watching from? Oh, Victoria from Bo, thank you. Mohammed Temple, thank you for joining. Where are you joining us from? Matthew Charles, I would like to know where you are watching from, really. You see, the essence of knowing where you are joining from and knowing your name is basically at every point in time, we want to make this a community whereby we know each other's name, we know where you are joining from. So the moment we drop, we start any live broadcast, I don't even need that again. I know that this is where you are coming from. This is a community. This is a family. Auntie Marie needs this community, and we want everybody to live healthy. Williams Ezekiel says, watching from Upper Lent. Oh, thank you so much for joining. Patrick Solomon, thank you so much for joining. We would like to know where you're watching from. Mosetta from Waterloo. So Waterloo again, 2-0. I'm still looking for other people joining from other parts of Sigelion. Julia Wanatu, thank you so much for joining. I would like to know where you're watching from. Fatmata, thank you so much for joining. Where are you watching from? Muhammad Fuad Kamara, thank you so much for joining. Where are you watching us from? Kumba, from Kenema. Kenema represented, yeah, that's good. Mohammed Conte, oh yes, Marisol, the Mami Forward Body. Grace Lima, thank you so much for joining. We'd like to know where you are watching from. In about another 1 minute, we'll be starting fully. So I expect a lot of people to have joined by now. Please share this live broadcast. It is very important. We all need to learn at the same time. And trust me, this is our first live broadcast. So what will it take you to invite your friend or your family members in? Okay, so I'll be adding 2 extra minutes. So by 3:10, we'll start officially. Grace Lima, thank you for joining us. Where are you watching from? Rogas Shanti, where are you watching from? I would like to know. You are welcome. I'm saying again, Happy New Year to you. Kabbalah Bridge. Hey, our Kabbalah people, you are here. We are very much happy this is happening. Thank you so much. It's all of your effort. You all contributed to this. And we always like to come over and over again to ensure that we are healthy all together. Martha, where are you watching us from? Thank you for joining. Henry, Sandy, Collins, thank you so much. Thank you so much. Thank you so much. So we still have 2 more minutes to go. 2 more minutes to go to start officially. Please kindly start dropping your questions right away. If you have bothering questions, I've told you, you will have the right answer live and direct. So there's no point asking your friend. There's no point being confused over any else. When Auntie Marie Day here, it's not possible. Henry joining from India. Oh, thank you so much for joining. Imamusu, Monica Kalon. Thank you so much for joining. Where are you joining us from? We want to know where you're watching from. Our Sam from Bo, thank you, thank you. Lucinda Jallo, thank you so much for joining. Please do well to share this live broadcast. Please do well to share this. I know what I am saying because you are going to learn a lot. This 2025, we are taking charge of our health. Nothing is stopping us. Everybody will be healthy and we understand our body. B-Banks, thank you so much for joining. Happy New Year. Patrick Thomas from the Gambia. I'm loving this. Thank you so much. Thank you so much. Auntie Marie can be less proud of you guys. I'm telling you. MC Chelsea FC, thank you so much for joining us. We would like to know where you are watching from. We have just 1 more minute to go live, like live and direct, and we'll start. Lucinda Jallo, thank you, thank you, thank you. Shiba Concepts, where are you joining us from? Happy New Year again. Greetings from Western area. We are saying greetings to you too. Abdul Karim Sise, thank you so much for joining us. Where are you joining from? It's so we are so glad to have you on our screen. Maria to Sherif, thank you for joining. What's it called? Sadia, thank you for joining. Where are you? Oh, hi. Momoon, hi, Auntie Marie. Hi, Happy New Year. Eda Junisa, want to know where you are joining from Wickinsey Road. Please don't forget, you don't have to be stingy about this. Do help your friends, your family to help get access to this live broadcast too by sharing. It will not take anything. It's just to share. Just share and you are learning and other people are learning. So we move. It is exactly 3:10. Officially, I want to welcome to the Marie Stopes live broadcast. My name is Dr. Dami, your favorite doctor. And this year, we'll be doing a lot of live broadcasts. And this is what you can actually do for us. We want you, as much as possible, that we are bringing this to your screen. Come with your bothering questions. Because we have to work hand in hand. We have been able to notice those that joined first. I hope other people too. We hope other people too will also be able to learn from this, because I'm not sure this giveaway, Auntie Marie is ready to stop this giveaway at any point in time. We are here for you. So let's start. So one of the first things that we would like to address first is that emergency contraceptive thing. I've seen a lot of questions, people asking, can I take it daily? Can I take it weekly? Can I take it monthly? And you are popping it like paracetamol. The beautiful thing is that emergency contraception is another form of short contraception, yes, no doubt. But then, if you keep on taking it daily, you take it weekly, you take it monthly, you are doing things the right way. You are doing things the wrong way. It is called an emergency contraceptive for a reason, and it has been designed for occasional emergency use only. That means maybe you have had an unprotected sex and you want to prevent unplanned pregnancy. Emergency. Listen very well. This is called emergency for a reason. It is not what you should, and it should not replace the regular contraceptive. Now, let me now tell you one thing you do not know about emergency contraceptive. The thing is that emergency contraceptive work by releasing some hormones already in your body. And how do those ones work in return? They will actually delay ovulation and probably interfere with implantation or fertilization of your egg, if you take it as early as possible. I know a lot of us, you are aware of our emergency contraceptive, which is the backup pill. Just like the name implies, back up. I have had an unprotected sex, unplanned sexual intercourse, and I want to prevent unplanned pregnancy. However, if you continue to use it, if you continue to use it on a daily basis, there are some things you might be experiencing. Number one, it might mess up with your menstrual cycle. That means you have an irregular menstrual cycle or unpredicted menstrual cycle, which is actually not so fine. Another thing is that as much as emergency contraceptives are very effective, they are not as effective as the regular contraceptive. Meaning, if you keep on popping it, it will fail you. No wonder a lot of people comes with, I'm taking the emergency contraceptive, but eventually got pregnant. Two things. You might be taking it when it is wrong. Probably you had already ovulated before you took it. And if ovulation has taken place and you now took about 6 days before you use it, you definitely get pregnant. And if you have been taking it over time, trust me, it might fail. So rather than that, there are a lot of methods that are available for you. And that brings me to the topic of family planning. I know a lot of times we have said it over time, family planning. But then it is my joy, it is our joy to bring it back to you. So let's talk about family planning. So what are the different type of family planning that we have? You can easily say we have the short term and we have the long term. So I know a lot of people would have heard about family planning, you know some, and some of us still have the fears about family planning, and we are here to break it down. Number one, the short term. An example of the short term is condom, because of course, at that point in time, you want to use it, and that's the end. It will only prevent you from unplanned pregnancy, and also has a dual protection or dual advantage. It will prevent you from STI too. Another one is the emergency pill. But don't forget, even after this live broadcast, if your major takeaway will be like, emergency contraceptive should not be popped like paracetamol. It should not be popped like vitamin C. I should only use it occasionally, or rather just take up in regular contraceptive. Another one that we have is the daily pills. So if you are this kind of person that you don't want to take injection, you don't want anything to your body, but you are good enough to always remember your pills, of course, you can take the daily pills. And we have the well plan. We have the Maristobes well plan, which is a daily pills. And this only prevents you from unintended pregnancy on a daily basis. Whether you have sexual intercourse or not, you must take it. And you must not miss the pill. Moving on, I'll be talking about the monthly. That's the 3-monthly family planning. The 3-monthly means when you take it now, 3 months after, or when it's about to reach the 3rd month of you taking it, you are meant to take another dose if you still want to continue preventing unplanned pregnancy. And that is even very easy, like very, very, very easy. You just take a shot and that's the end until after 3 months. We have the Depo-Provera. We also have the Cyana Press. All of these are available at our centers, Bo in McKinney, the Ahmed Drive in Freetown, Kissy in Freetown, Waterloo Street in Freetown, Waterloo Rural, and all of that. You always get it then. Leaving that aside, so let's talk about the Almighty. The Almighty. We have the Captain Ban, the one that will place here. Now, a lot of people think that we have to cut this place to put the Captain Ban. No. It is just the same way that you are going to have this prick of injection, even if you are taking the injection. That's all it requires. And it is a very simple procedure. And it is very safe. It doesn't move from wherever it is. It is not possible. Aunty Maria has been on saving lives, women's life, men's life, sexual and reproductive for a long time. Our staffs are well trained to provide these services. So it doesn't even take anything. It's just to get a small opening, insert it, and that will be all. You have the plaster there, and at the 4th, 5th day, you remove the plaster yourself. And one thing about Captain Ban or any the IUD or coil, you don't need to come back again. Once you take it, until the time that we have indicated on your card that it will expire, that's when you have to come back, maybe to remove it and replace. That is the way it works, basically. Lastly, I'll be talking about coil. So how does coil work? Coil is inserted into your womb. Now, don't freak out. It is not something so hard. The same way we can examine inside the vagina, that's the same way we insert it. And for me, it's even one of the best. It is one of the best, basically, because the moment you insert it, that's all. For up to 10 years, you are safe, you are protected. However, even for the Captain Ban and both the coil, as soon as you are ready to conceive, just come and remove it. I'm sure a lot of people have had experiences of all of this family planning method, most especially the Captain Ban and the coil. The moment you remove it, my dear, be ready. Be ready. Just go and buy your things. So that is the way. Emergency contraceptive is not to be taken daily. It's not to be taken weekly. It's not to be taken monthly. Use the regular contraceptive, and they are safe. Let me quickly go through the comment section and answer some of our questions before we move ahead. So, Joshua, welcome. Zeno Bangra from Waterloo. Stephanie, welcome. No. Trust Aunty Marina. The giveaway, a day. Forget about it. Williams, Ezekiel, thank you so much for joining. We'd like to know where you're joining us from, where you're watching from. Sarah Koroma, thank you so much for joining. One day, MK Content, thank you so much for watching. Where are you watching us from? Museta, is it possible to bleed for 2 weeks to 1 month after an abortion? What we offer is post-abortion care. And in post-abortion care, there are different types that are available. No, post-abortion care starts from, if you are having, this bleeding, we'll help you take care of that, give you some antibiotics, give you pain relief to ensure that you are healthy. However, when you come to our center, there are basic things that you are supposed to know, even as you are going through it. So, Image Salon, thank you so much for joining. Where are you joining us from? Asia Tutarawali, thank you so much for joining. Hey, Benito, this makeup is babe. Thank you so much. We'd like to know where you're watching from. George Lamin from Bold District, thank you so much. Shannon Scott, thank you. We'd like to know, we just want to know, this is very important to us and it means a lot. And don't forget, do not be stingy. Share this live broadcast with your friends, with your contacts, with your enemies. Williams Ezekiel, is Aunty Maria available? Of course. So let's talk about our services that are available for men. Number one, the family planning as well. Yes, men can get it. The family planning available for men is the condom and the vasectomy. So let's talk about the condom. We have the male condom. I'm sure that a lot of us will seen what the male condom looks like, and you can get it as well. You can even walk into our center. And for pleasure, to get your desired pleasure, please try the flame condom. Flame condom is there. So it's another type of our services that is being offered. Vasectomy. Vasectomy is a permanent family planning procedure for men. You have maybe 5 wives, and you have about 20 kids. You don't want to give birth anymore. You can have a vasectomy done. It is a permanent procedure. That means it is not reversible. So it's not as if we are cutting in part of you. It's just a little slit to obstruct where the sperm flows through. So once that happens, then you are safe. You can actually prevent unplanned pregnancy or getting other people pregnant. However, it will not stop you from performing. You'll still be able to perform. I know that's one of the concerns, worries of a whole lot of men. So aside from that, all of our services available for men Even the general healthcare, if you have been to our center, you see men there. You have headache, malaria, what have you, anything, just come inside. We attend to men, including children. Now, other services, lab services, it is not bad. Even as a man, what makes you responsible as a man in this 2025? Having your screening done. It will not take you anything. It will not cost you so much. Just walking into our center across Freetown, you will have what? You have the screening done. Also, we'll provide fertility services for men. Now, a lot of people think that when it comes to fertility, the only person that is being concerned or affected is the woman. But I can tell you 100% that you are wrong. You are wrong. Now, fertility can be infertility or subfertility can either be from the female or the male. And both of them, they have equal contribution. So it is 50-50. So for our men, we have a lot of fertility services. You can have the test done. Anything. I know some of the men that are even joining this live broadcast can attest to that fact that yes, we offer these services and we've been seeing results over time, like big results. So there's nothing stopping you as a man. Anty Marie is for everybody. It's for women, it's for men, it's from children, the adults, the elderly, the menopausal women. You have attained menopause, your mother is no more menstruating again. They can as well come for our services. We have the cervical cancer screening available. Shortly, we'll talk about cervical cancer because January is Cervical Cancer Awareness Month. So let's read some more comments and questions. Mariati Sheriff says, watching from Facedown, Auntie, are you the admin of this year? You want to check something? Auntie Marie is the one behind the page, not me. I am just one of the doctors in Marie Stop. Okay, Amara Alfred, watching you from my, oh, thank you so much for joining. Mariati Bangura, thank you so much for joining. Williams, thank you. So Sandy, why do pelvic inflammatory disease keep coming even after treatment, and how can it be cured permanently? Thank you so much. Sending you virtual hugs. Sending you virtual hugs. So let's discuss pelvic inflammatory disease. As the name implies, pelvic, the lower part of your abdomen. I will break it down so that we all need to understand. And you too can be an advocate of health. You can be able to help people to live an healthy life. So pelvic means just below your abdomen. And that area is very important because it has a lot to do with your sexual and reproductive health. Inflammatory, definitely there's an ongoing infection. It's a reaction to infection. Have you noticed that when you have maybe a cut on your hand or you bruised your hand, shortly, few minutes after you would find out that it's swollen? That is an inflammation occurring disease. Now, pelvic inflammatory disease is not just one. It's a broad term. So any infection happening from the vagina, from the cervix, from the uterus, from the endometrium that's inside of the uterus, everything we lead to is what we call pelvic inflammatory disease. Now, usually a lot of people have this and they keep having repeated infection because it's not being treated properly. Now, a lot of us, we are used to this. Oh, I'm having abnormal discharge, and your friend gives you a particular capsule or a particular drug, and after that, you feel relieved, and that will be the end. And before you know it, 1 week, 2 weeks, it will still return back. That's because you are not treating it appropriately. Now, treating pelvic inflammatory disease is not just about popping any antibiotics. If the cause of the pelvic inflammatory disease is actually fungal, when you take antibiotics, it will just give you a temporary relief. It will not solve it. If the cause is viral and you are taking antifungal, it will not work. And that's where Aunty Marie comes into play. If you notice anything, don't just assume. And the more you keep popping different medication and you are doing trial and error, the more danger you are putting yourself into. The more danger you are putting your reproductive health into. So that is the way it works, and that is why it keeps coming again. And it is for a specified period of time, depending on who is seeing you, depending on your service provider, depending on the result of the test that is being done. That's how we decide for how long should you take this medication. So if you are supposed to take this treatment for 2 weeks and you are taking it for just 3 days, you feel a bit of relief and you stop taking it, you stop coming to the clinic, I'm glad to tell you that it will definitely return back. So it has to be treated, and the root cause should be treated. Two things I've mentioned there, two very important things I've mentioned. Number one, because the root cause has to be addressed. Number two, the duration at which it is meant to be treated needs to be achieved. I believe I've been able to answer your question, Leonard Abbas Kuruma. Thank you so much for joining. Want to know where you are watching us from? You want married auntie marry? Okay. Why does emergency contraceptive end up having spotting? Yes, spotting can come up with emergency contraceptive because what? If you are taking it regularly, and don't forget to say it contains hormone, and what this hormone is meant to do is to delay ovulation or prevent implantation. It's just a side effect. Spotting is it. Now imagine if you continue popping it daily, weekly, you continue, and it will mess up with your menstrual cycle. That means you are supposed to ovulate today and you have had an unprotected sex a day before. So what should happen is that immediately that sperm is being released, it can live up to 70 or even 3 to 4 days in your body. So the moment you ovulate the following day, it will fertilize it and become pregnancy. Do you understand? But when you take the emergency contraceptive, take for instance the backup, our own backup pill, when you take it, it will delay the ovulation. You are supposed to ovulate the following day. It will delay it. It won't come at that point in time, so as to ensure that the life of the sperm expires before you ovulate, and by so doing, pregnancy will not take place. But one of the side effects is spotting, and don't forget, it should only be taken just occasional in an emergency situation. I hope I've been able to answer your question. Queen Manji, Sally Timbo, thank you for joining. We want to know where you are joining from. We want to know where you are joining from. How to use 72 hours. What's 72 hours? Please, could you please help me understand what you mean by that question? Abdullah Kamara, what do you mean by how to use 72 hours? Example of short-term family planning, condom, emergency, daily pills. Thank you so much, Sandy. You have said a whole lot. Sadia to Mustafa, thank you so much for joining. I'm trying to see if we have other questions before I move forward. Oh, thank you so much for joining. Don't forget, I learned that your contraceptive are the causes of fibroid. You really want us to talk about fibroid? Okay, that's fine. So what is fibroid itself? Fibroid is an abnormal growth that can happen inside or outside or any area within your reproductive organs, in your, maybe on your uterus and all of that. Now, whether you take family planning or you do not, a lot of people might have fibroid. In fact, for women, we start having, we start having some seedlings of fibroid. Now, let me tell you the way fibroid actually works. Just imagine where you are. Imagine where you are, like our office. People do not come to office. Nobody is working there. Nobody is doing anything, basically. It's just there. You start noticing that there are some weeds growing. That's the way fibroid is. Fibroid has nothing to do with whatever you are doing with contraceptive. The moment is desolate. That's why a lot of people that have one of the common cause of infertility, which we'll address in another video, is fibroid. One of the common cause of infertility, because nothing is happening there. And you see, for a lot of people, when they have fibroid, the moment the fibroid is being removed, except if there are other complications, the person gets pregnant. So another reason why someone might be predisposed to fibroid is we, our race, black race, we are predisposed to fibroid. Aside from that, not giving birth early can make one have fibroid. I've just explained how that one works. Having a desolated place, weed will start growing. Fibroid is just like weed, basically. That is it. It's like an unwanted plant. Aside from that, family history. There are some people, if you ask their mother, or if they ask their mother, they will tell you, oh, one time your sister or something had it. You are at risk of having fibroid. So basically, family planning is not the cause of fibroid. Fibroid can come as a result of all of those things that I've mentioned earlier. Kabiayeno from New England, thank you so much for joining. Samura, I would like to United States for Ogo Farm. Thank you so much. Thank you so much. Now whose time are the easiest time for give you wife belle? It doesn't matter. See, your sperm is not being affected by gravity. Whether you like it standing, whether bending, whether missionary, anyone, if there are no underlying issues while your wife is not getting pregnant, but then it's left to you and your skill basically. So thank you so much for joining us. Thank you, thank you, thank you, thank you. Hey, thank you so much. But what about the body hormones? And also, what's the approximate amount can I hold for general screening? Now, for a general screening, like I said, it depends on what kind of test you are having done, what type of screening you are having done. If you want to have your what's it called, HIV, hepatitis, syphilis, and all of that, you want to have it done. It all boils down to the kind of test that you are having done. But at the same time, we at Maristop want to work with you. We are not so particular about how much do you have, how much are you holding. It's not a matter of if you bring millions, you'll be able to do it. No, no matter how much you bring in, our priority is to ensure that you get healthy first. You are able to afford the service and you are able to access it. So our staff, our service provider will work hand in hand with you to ensure that whatever your budget is, we are able to work with it and treat you. However, there might be need for you to get medications after having the screening done. If need be, you also be told. And even if you don't have up to that amount at that point in time, you can still go and come back. You will still have your records there and you still get it. If there's a need for an appointment, we'll schedule an appointment for you. And even for the first few weeks of the first appointment, you don't have to pay for consultation anymore. You just have to come for follow-up. So tell me what's stopping you. There is no, just work with your budget. We are here to help you plan your finance and still ensure that you get what? Adequate health care services. I hope I've been able to answer your question. Do you guys help with addiction people? What type of addiction? That's the question. What type of addiction? What is the best prevention to take? Now, Sadia Umatu, prevention is not a one size fits all. It depends on what fits you. It depends on your desire. How long do you want to prevent for? What would you like to see? What kind of changes? What is your weight? Are you on any medication? Do you have any coexisting disease? Those are the things that we want to know before we counsel you to help you make informed choice. It is not for us to say that this is the prevention that will work for you. It is not in our own place to look at it. This is big, like this you for take. No, not so. We will help you make the informed choices. And that's why when you come, we take our time to take you through. You have your own time with us. We take you through and you'll be able to say, oh, since you have explained this to me, this is what works for us, for me. And we'll be able to tell you the pros and cons of everything, basically. Now, take for instance, if you are only planning to prevent pregnancy for, let's say, 6 months. But because I know that, oh, the Captain Ban is good and everything, I give you Captain Ban. Yes, it might be able to achieve its goal, which is what's it called, prevent pregnancy. But then you only need it for a short time. Or peradventure, you really want to prevent for up to 5 years. But because you like injection just once every 3 months and I give it to you, I've not been able to help you address your need. Your need is that you want to prevent for up to 5 years. Do you understand? You want to prevent up to 5 years. So by so doing, we'll look at it together. We'll both make the decision. That is the way it works. And the fact that a friend of yours or a sister of yours took injection does not mean that injection is the best for you. So when you come into our center, we'll help you make informed decision. I took depot only one time. It's been 4 years. I want to conceive, but difficult. And I've been having menstrual cycle. Oh, I'm so sorry about what you are going through. Honestly, Sandy, I am so sorry. But one thing that I want you to address first is that depot is not the reason why you are not conceiving. It might not be. There might be some underlying issues. And let us get this right information that family planning might not be the reason why you are not. It's not even the reason why you are not conceiving. There might be other issues that needs to be checked into and you need to be examined. Imagine your menstrual cycle, if it is normal, other things. Just below. So let me just mention to you, some other things can be PCOS, polycystic ovarian syndrome. So what happens is that every month, you are supposed to release egg. When you release those eggs, if you have an unprotected sexual intercourse, it will lead to pregnancy. If you release that egg and there's no unprotected sexual intercourse, then you have your menstruation and all of that. But then, in some cases, those eggs are being released as small, small, tiny eggs, which are supposed to mature over time before your next cycle. Considering the hormones that you have in your body, they will help mature this egg. It's just like having a tree of mango. It is not the same day that you plant that tree that you start seeing mango on it. It has a season. And once the season comes, what is being expected is that at that point in time, you should be able to pluck it and eat it. It has served its purpose. Now, in case of PCOS, polycystic ovarian, there are a lot of eggs available and they just contain water, and they are not maturing. So ovulation is not happening. Aside from that, there might be other syndrome or other abnormalities which you call Asherman syndrome. In Asherman syndrome, inside of that womb, for maybe repeated infection or PID, they are narrowed. So there's hardly where the sperm can pass through. And as a result of that, the person will not be able to do what? Not be able to conceive. Aside from that, fallopian tube blockage. Now imagine somebody, you are taking this thing, you have left the particular prevention, but this person has this lot of underlying issues. So when you don't come or you just assume, we don't check you, you will not be able to know the reason why the person is not being able to conceive. Like fallopian tube blockage. After the release of the semen and it enters into the womb, it doesn't stop there. It goes to the ampulla. The ampulla means the covering, like there's a place in the womb where you have the fallopian tube. Just before it bends to where the egg is, that's where the sperm will stop. And the egg also will be released to that part of the fallopian tube, and fertilization occurs there. After that, it will now move back inside the womb for the pregnancy to continue once fertilization has taken place. Now, if there's a blockage in there, the sperm will not be able to reach the eggs and fertilization would not occur. All of these and many more are reasons why people might not be able to conceive and not, what's it called? Family planning. Fibroid too. Fibroid, if it is there, no matter how small, no matter how big, imagine somebody that has fibroid and is even bleeding heavily. How would that kind of person have enough time to even have copulation with the husband, to have sexual intercourse? It will not be regular. It will not be regular. And it might be difficult for that kind of person to conceive. And even the fibroid might even be staying where the fertilization is meant to take place. So all of these are reasons why fertility or conceiving might be very difficult for some people. Do you understand? So it is not something that you just sit down, you think about it, you look at it that I'm not conceiving is because of no. You have to come back to us. Trust me. We're there for you. Aunty Marie there for you. Let's access you only. And that's one thing I can tell you for sure. In every of our centers, we don't just do, okay, you are not conceiving, take this medication. We want to know the cause. We want to know the cause. I know a lot of you that are watching me, you even know a lot of medications. And a lot of people take folic acid. I want to conceive. I want to get pregnant. You start taking folic acid, folic acid. If only you know that folic acid alone will not let you get pregnant. And you stay there. And don't forget, fertility also declines with age. As you continue aging, your fertility begins to drop. That is because for you as a woman, the moment you have been giving birth to, you have the total numbers of eggs that you have and you will release and will be fertilized. So if you are taking too long, for whichever reason, and you are not, what's it called, getting pregnant, as you age, your fertility declines because for every month, you get to do what? You get to release those eggs through menstruation. Okay, can you guys treat someone who is in a period like 2 or 3 weeks? Of course. What are we doing? We are always here for you. Those are just that's the little, we offer every service. Anything you can think about health, walk into our center. Feel free. Talk about it. We are there for you. And trust me, you always have your session. So confidential. There's nothing treating period. No, forget about it. Aunty Marie does this better. Aunty Marie does this better. So most of your contraceptive drugs are causing women to menstruate abnormally. Why? Okay, so thank you so much, Derek, for raising this question. And I think I want to talk about contraceptive drugs and menstruation. Now, contraceptive methods have some side effects which might be spotting, irregular bleeding or irregular bleeding, excessive bleeding, or not menstruating at all, depending on the kind of hormone that you are taking. Now, the way it works is that they contain hormones, and these hormones, you have it in your body already. So when you introduce a contraceptive method, you are adding an extra hormone, and your body gets to sense it that, there's a foreign body here. What's happening? It's beyond what I used to accommodate before. So all of these hormones are in a particular level in your body already. So when you take the contraceptive method, it increases it because we need to delay ovulation. You need to delay ovulation. You need to ensure that inside of the womb is not suitable enough for any sperm to pass through to make it slippery. So that's what happened. However, nothing good comes easy. One of the side effects might be irregular menstruation, depending, and some people might not even see their menses. The good thing is most contraceptives are reversible, meaning the moment you stop them, you return back to your menses. Now, basically, it is not our contraceptive drugs that make people menstruate abnormally. It is just a side effect that is temporary. It is a side effect that is temporary. Now, when you take family planning and you notice any side effect, which I am very sure, as soon as you enter, one of the things I want to tell you about family planning, as soon as you enter the office and you start is, we will always tell you the side effects. These are the things you should expect. But where people get it wrong is that you don't give it time. You have only heard about, okay, it will help you prevent, pregnancy for this particular period of time. But you are not interested in working in the process, which is very, very important. These side effects are just for a short period of time. Captain Ban, for example, for some people, they might not even see their menstruation. And for some other people, they might menstruate they are just side effects. I've just explained the pathway of how the side effect comes into play. You have these hormones in your body already, and you are introducing another one, thereby increasing the level, delaying ovulation. Do you understand? So the side effect might be your menstrual cycle might need to be balanced. So maybe for the first month, it might be excess, it might be reduced, it might be spotting, but give it time to work. Give it time to work and watch. But you notice that it's becoming unbearable. Nobody has ever received champion or has won an award for harboring something that is unbearable. If you are menstruating and you are changing your pad like 3-4 times, we even give you appointments because we want to work with you. We want to know how it's working with you. If it's something that is unbearable, please come back. But do not forget, when you come back, let's look at it, how best we can salvage that kind of side effect that you are going through. So basically, it's not a contraceptive. It's the way the body reacts to it. Some people will take their pill, they will see their menstruation. Some people will take the pill, they might not even menstruate. So that's the way it works. It's all because of your hormones. What is the best contraceptive? I think I've been able to answer that earlier. I've said that earlier. So greetings, doctor. What will happen to men who double trouser and non-BS? Okay, equally, women who use chemicals to clean themselves. Daniel watching from both. Daniel, I got you. So for men who doubles their trouser, I don't know. Do you know those two things under you? Those eggs. Do you want to eat them? Do you? Because you are boiling those eggs. And the more you boil them, the more you are killing the sperm. Yes, it's not healthy. Why are you wearing double trouser? For what? For security? The more you do that, the more you introduce it. It will boil them, and they will not, what's it called, the semen there or the sperm cells, they will all die. That's what happens. So as well, if you double it, just imagine, this one is practical. If you double your trouser, there is it. You will sweat, you will urinate. Some drop of urine will drop on your trouser. From there, the sweat and the yeast and everything, they will collaborate, all join, and infection will set in. So it is not right. It's totally wrong. Women use chemicals to clean themselves. For what? Even naturally, your vagina has a way of cleaning itself and keeping itself healthy. You don't even need all of those things. You do not. Using chemical will just alter the pH of the vagina. So the pH of the vagina has a normal pH whereby it helps to prevent bacterial infection. It helps to take infection away or any virus or any bacteria. Now, when you introduce chemical, you alter the pH of that vagina. And at that point in time, bacteria are free. Then you start dealing with infection and all of sorts. So it is not ideal. Woman, if you have your friend, you have your family member that have been doing that, say that Auntie Marie say you're wrong, not right. Because why? It will clean itself. If you are very hygiene, you are wearing the pants that you are meant to wear, which is the cotton, it is breathable, and you are changing your pads daily. You are not wearing one trouser for 6 days without wearing a panty liner or a pants. Trust me, you will not have any odor down there. It's not possible. Where will discharge come from? It is not possible. But when you do all of those things, you alter the pH of the vagina and you give room to infection. So I think I've been able to answer your question. Kaba from Ghana, thank you so much for joining. When will you talk about erectile dysfunction? Thank you so much for talking about it. Erectile dysfunction. I think in our next live broadcast, we'll discuss that effectively. I like the fact that men are coming out and they are saying the part that concerns them. It gives Auntie Marie a whole lot of joy. I want more men to come up. Let's discuss about this issue. It's a whole lot of things. You have a lot of things to bother about. But in our next live broadcast, we'll definitely talk about erectile dysfunction. Okay, thank you. What if your husband refuses to go with you to the hospital with treatment to an individual person concerning childbearing? Now we are in Africa. And one of the things that happens in Africa is men are so egocentric. We don't want to accept blame. But even over time, during the course of my practice, I have over time seen men having issues. Now, that one is a social problem. You have to have a way that you can convince your man to come to you to the hospital, because of course, it's not just about the woman. The problem might be coming from either ways, maybe the man or the woman. So it depends on you, on how well you can convince. Sometimes I go extra mile of, after I have accessed the woman, I will tell you there's no problem here, but I would like to see your man. And it goes like, you might not be able to come. Sometimes I offer to speak to your husband over the phone. Now, I'm a professional. I'm nobody. If you had gotten home and said something, at times they might not even know. Because how many times do men go to the hospital to go and check their sperm count and all of that? And those are the things that you should do on a normal day without having anybody to even tell you. You just want to know. You just want to know if you are healthy, and it involves that. So if he refuses, you just have to find a way to talk to him. That he's just going to the hospital. And men, I know a lot of you are here. Please encourage one another to go to the hospital. Let's do better this 2025. Where is your office located? I want to meet you in person. My office is located in every of the center. You can book any of the center, definitely. And one thing that you should even understand is that the way Maristop work is not just one person that can give the best of service. Every one of us have been trained the same way. We offer the same service. We offer the same treatment. As long as you are not keeping anything from us, you are being open enough to tell you what your problem is. Trust me, we are trained and we are confidential enough. So anybody can as well treat you. Any of our service provider, and we'll be professional about it. But then, any of the centers you can book an appointment. Where are you located? I've just told you. Satan Sailor agree you. No agree for Satan. Beautiful man, thank you so much. Thank you so much. How safe is withdrawal method? Na scam. Withdrawal method na scam. It is not safe. It will fail you because your body only needs a tiny drop of semen that contains sperm cells to get pregnant. So no matter how best your man can be telling you he has been doing with that method and it works and everything. Has he even checked himself in the first place? Maybe there's something wrong with the sperm. But then with that method is not 100% safe. It is not 100% safe. It is not 100%. I don't want prevention that can cause overweight. What kind of thing do you think? Those are the things we are talking about. When you come to our center, let us know what you want. And we'll be able to help you, guide you, choose the best method that will work for you. We are almost rounding up. IUD coil prevention. Okay, no. It depends on you, basically. It depends on what you want. Meaning lack of sex in women is the top cause of. It's not lack of sex, basically. I didn't say lack of sex. If there is no reproduction, pregnancy, happening there. If a house is just there, nobody is living there, nobody is cleaning it, nobody is doing anything, weed will grow. Same thing applies to fibroid. But then it is just one risk factor. It does not necessarily mean that if somebody is not getting pregnant or is not having sexual intercourse, he will have fibroid. No. It doesn't work that way. There are some other, even lifestyle, smoking. You see that smoking and drinking. A lot of you might not agree. You might be, but let me tell you, this is the sad reality. Excessive smoking, excessive alcohol is the primary cause of is one of the causes of a whole lot of diseases and a whole lot of problems. Take for instance that fertility. I saw a comment about somebody saying that their father or something smokes a lot and this thing and they have children. Now, it is not being said that because you smoke or something, you'll not be able to have children. No. It just means that even when you are smoking, it might be the reason why you are not getting pregnant. And this is the way it works. The, what's it called? The smoke or whatever you are smoking contains some substances. This substance, they will go in ahead to destroy the sperm cells. They destroy the sperm cells and make the sperm cells even very low or not even, or even destroy them basically. They can mutate the gene. And now a lot of people smoke and they drink, of course, and they have children, but it's just a risk factor. I've seen over time clients that have counseled, oh, your wife is trying to get pregnant. Avoid. One of the things I will always remember to tell you, if you are smoking, you have to go on recess. You have to go on holiday. And I've seen it work out. So if it is not something that is not attributed to it, and studies have even showed it over time, then definitely it will not be part of the side effects. This is 3:52. Yeah. So thank you so much, everybody, for joining. I believe that you have been able to learn one or two things. In fact, multiple things. Please, is it true that lubricants can cause infection? Well, it depends on the type of lubricant you are taking. Yeah, it depends basically. But if you are to use lubricants for any reason, saliva is not lubricant. Vaseline is not lubricant. Stop it. There are water-based lubricants that are meant to be used. Just go to, very soon we are having our own lubricants, but you can go to any big mart. Tell them you want to buy a water-based. Water-based because it doesn't contain chemicals and there will not be reaction and you will still have a pleasurable sexual intercourse. My husband and I have been using withdrawal method for 6 years now. Great. Interesting. Does Maristops have sanitary? Yes, of course, we have our sanitary pads available. And trust me, they are made with the best of materials. You will not even feel anything is there. I'm telling you from experience. I'm talking from experience. I don't have anything to worry about. I'll just put there. What is the cost for scanning? What kind of scan do you want to do? It all depends. But about 160, yes, you can have the scan done. So we do scanning and all of that. Thank you so much for everybody who has joined. I want to believe that you've been able to learn one or two things or multiple things. And we have about 6 more minutes to go. If you have been listening or you joined in between, I will want to see you type now in the comment section. What have you learned? Just 2 things. Let's go. And I'll be reading out the comments. What have you learned? What have you learned? I want to know. I want to be sure that you have been able, and I want to be sure that we have not just wasted time. You have not wasted your time. I have not wasted my own time. We have talked about infertility. So you have learned. Mohammed Toure says that saliva is not lubricant. But Batisa in Equatorial Guinea used this as a great product. Anyway, I've just told you. It is not a lubricant. It is not a lubricant. So I want to know what have you, yes, Lucinda, you are welcome. I want to know what you have learned. If you have learned anything, if you have learned the cause of fibroid, if you have learned about family planning, if it is just one method of family planning, if you have also talked about family planning, no, you have learned a lot, I know, just mention. I want to see the comments. We have 5 more minutes to go. No, I need a feedback now. If it were to be a physical thing, we would have also talked, but then I want it to be interactive as well. Let me learn from you too. There might be some things that I missed out that you also know about it. I want to see them in the comment section. Please go ahead now and drop whatever you have learned. What other things that you have heard? It might be a myth. It might be a misconception. We might be able to address it in the next class. I've learned about PCOS and infertility. Thank you. That's fantastic. I want to see other people to drop what they have learned. I want to know what you have learned over time. What you have learned today. Because the moment you can pick that you have been able to learn that family planning is not the cause of infertility. You have learned that PCOS can lead to infertility. Fibroid may be one of the reasons why one is having infertility. if you have also learned that not just any family planning method will work for you, you have to be counseled and go through the process. I've learned about types of family planning. If you have learned that emergency contraceptive is not to be taken every day as paracetamol or vitamin C, write it there. I just want to know. We have 4 more minutes to go. I've not seen a lot of people reading anything. I've just seen just 2 comments. That means I've just wasted my time. You have not even learned anything. No, I have to learn from you too. So that will help me over time to know how best to help you. I've been able to answer all the questions. We have 4 minutes to go. I'm not seeing that tap. You people should tap. You cannot give me one likes. No, it is not possible. It is not possible. I want to see that tapping. Let it go ahead. Let it go. I want to see it. This will encourage me. We have encouraged you people for joining early by having the giveaway. So do the same. What about the oil from condom? Is it a lubricant? Yes, but it's not in Essex. It's not in Essex. Also learned that PID is caused by infection. I mean, different type of infection. Please go ahead to type what you have learned, and if you're liking, please, I want to see you double tap very well. Auntie Marie deserves more. I want to see that double tap. We have 3 more minutes to go. Double tap. We have a lot of people that are watching right now, and you're just giving me one like. No, it's not possible. It will not work that way. We have to be for each other, because we'll be seeing next week, same time, 3 p.m. on Friday. We have 3 more minutes. I want to see that love. Yes, Auntie Marie deserves it. I want to see that like. If it is still possible, please still share this link, or share even after dropping. So our giveaway is 100 Leon credits going to the first 5 people, and we've been able to take note of those first 5 people that joined and stay to the end of the live. Please keep that like rolling. Keep it. I'm seeing it and it's giving me energy. Not that you have to be following this page to win. The first 5 set of people that join this live will be receiving 100 new Leon credits. The top up is 100 new Leons, and you must be following our page. Thank you so much. Thank you. Please let the likes keep rolling. At least if you are not typing what you have learned, which I believe that you have learned a whole lot of things, I want to see the like. I want to see the thumbs up. Thank you so much. Also, another announcement: we'll announce the winners on Monday next week. Yes, Monday next week we'll announce our winner. Expect a DM from us asking for your phone number, because Auntie Marina talk and do. Note, we will not message you from any other account. Please don't allow anybody to scam you by entering into your DM. Marie Stop Sierra Leone will enter into your DM, we'll drop our message, and please, we'll need your phone number so as to do what? To top up your line. Please let the likes keep rolling. Please drop in the comment section what you have learned. If you have other questions, you can as well drop it. I want to see it too, and I want to give you an assignment. That thing that you have learned during this period, I want to see you post it. You know, when you post it, you will tag me, and I will know. So I will know our top followers. I will know people that are learning in class. That is the second assignment. Number 1, I want to see what you have learned during the course of this live broadcast. Number 2, I want you to post the basic thing that you have learned. One thing you don't know is that the essence of learning is to be able to help yourself and help other people. So even if you have learned that emergency contraceptive is not to be popped every day, if you just put that on your timeline, somebody will see it and learn. The person can even come to your DM that, how come you know about it, and you'll be able to explain. I want to believe you'll be able to explain all that I have said. And in that way, everyone is healthy. Everyone has the rights and the correct health behaviors. Please let it like keep rolling. The love, let it keep rolling. And don't forget, put whatever you have learned on your timeline and tag Marie Stop Sierra Leone. Our giveaway winners will announce you next week, Monday, and we'll be entering to your DM to get your number that will top up. At this point in time, I want to say a very big thank you to everyone who has joined this live broadcast. It's been a lovely time spending with you. I really wish there's still enough time so that we can continue. But trust me, next week, Friday, this same time, 3 p.m., we'll be meeting again to discuss many other health issues bothering your mind. And please don't come late, come early. We have another giveaway. We are ready to keep giving you giveaway as much as you are coming early and you are learning. Thank you so much for having us. This is from Marie Stop Sierra Leone, the Mommy for Well Body. Until next week, we say have a wonderful weekend, and don't forget, practice safe sex.